Okay, we are going to talk about diabetes and obesity. Diabetes and obesity is a very major problem all over the world, which includes the developed nations as well as the developing nations. In Malaysia, it is said there are about 4 million Malaysians with diabetes. I think it's an understatement. And the rate has risen from 13.4% of the adult population to 18.3% in 2019. Now for 2022, I'm told it's about 22%. Thereby, 1 in 4 adults in Malaysia is diabetic, have diabetes. And Malaysia is considered as the sweetest nation in Asia. Now, many of you will have all kinds of ideas about diabetes, which are very common. And you would be wondering, why is this chap talking about obesity and diabetes and whether it can be prevented or reversed? Now, what I'm going to share with you is a message which I have taken from this, not only these 5 gentlemen, but many, many more who have spoken about this. The first picture you see is Jason Fung. Dr. Jason Fung is from Toronto. He is a nephrologist who was very, very active in promoting this all over the world. The second person is Dr. Pradeep Jamnadas. He's a cardiologist in Orlando in Florida. He is also a very, very wonderful man who talks about preventive cardiology. The third person is Benjamin Bickman, who is a microbiologist and a biochemist scientist. He talks about cellular metabolism and cellular biology. And Dr. Robert Lustig, he is a brilliant pediatric endocrinologist who is a professor of pediatric endocrinology in the University of San Francisco in California. Last but not least is my beloved principal, who taught me 51 years ago. So many things that he taught, it is still fresh in my mind after 50 years of leaving him. And I take this opportunity to promise you that we will share something with you which is not widely known in the mainstream medical practice. Now, I need you to think of all these questions so in the back of your mind, so that at the end of our lecture, you will be able to make up your own decision on what is diabetes mellitus, when is it diagnosed, what is the role of insulin in diabetes, is blood sugar the major problem in diabetes, is measuring blood sugar sufficient to diagnose diabetes, what are the complications and what causes complications of diabetes, is diabetes a lifelong disease as propagated by the many diabetic associations all over the world. Can diabetes be reversed? This is a very, very audacious question. Nevertheless, we will look into this. Now, overview of what our discussion is on diabetes and obesity and weight loss. Now, these are the questions that we are also going to answer: diabetes and how it is diagnosed, and insulin, complications, and all those things. We will come to it as we move on. So in the old school, diabetes was diagnosed before the 60s by measuring whether there is sugar in the urine. Only in the 80s or late 70s in the West and early 80s in Malaysia, we tested using the home glucometer, and we were able to say whether a person is having diabetes based on the blood sugar level, which was at that time about 110 to 120. Now it has come down to 100. In diabetes, there are 2 types. One is the type 1 and type 2. Type 1 are those who have a problem with the pancreas. Either it's an autoimmune disorder, infection, or whatever reason. And those patients require insulin. You cannot run away from that. Now, type 2 diabetes is what we are talking about, where it sets in, or is also known as maturity onset diabetes. Now, Australian and American Diabetic Associations say that diabetes is a chronic progressive disease and modification is required for the rest of your life, and it is not reversible. That is the old school of thought. Now, the current new definition, as propounded by 4 friends that I have introduced you in the front, diabetes is a chronic metabolic syndrome disease that occurs when there is increased insulin. Please note, blood sugar is not mentioned here as the primary factor, and increased resistance in the blood with increased blood sugar. Personally, the blood sugar, I'm still not convinced after doing the research for the last 2 years, because the culprit in diabetes is a carbohydrate diet. So the carbohydrate diet is the singular factor which is raising blood sugar.
How about the sugar that we take? Sweet stuff?
We'll come to the question later. We'll come to the question as we move on. No issues. We'll come to the questions. Yeah. Carbohydrate means it includes sugar as well. Sugar is refined carbohydrate. So all carbohydrates are the only cause of the major cause of rising the blood sugar. I'll show you a graph where when one takes any carbohydrate food, the blood sugar will spike. The next one that causes a halfway spike would be proteins. And if you take fats, it is a very low rise in blood sugar because it does not stimulate the pancreas to produce insulin. So that is the main reason. Now let's look at what are the complications and who are the doctors and pharmacies involved and how the whole industry of diabetes is structured, right? Starting from the ophthalmologist, endocrinologist, every single part of our body is damaged. Once upon a time, my lecturers used to joke and say that TB could cause everything except pregnancy. So looks like the second factor is diabetes. It can cause you all the problems except pregnancy. So you see that once upon a time we used to be diagnosed, when we were diagnosed as hypertension, doctors used to label as essential hypertension. But actually, now we know from the research done by all these doctors, it is because of diabetes. Diabetes is interfering in the metabolism of fructose to produce uric acid. And uric acid metabolism is impaired, and that stimulates the blood pressure to go up. What I'm telling you is absolutely new. Not many doctors in Malaysia will agree, but 100% in 2 years, everybody will be talking about this. So these are very, very new topics.
Please repeat that, doctor. It's a bit too much to absorb.
Okay.
I'm trying to memorize what you said.
I'll give you the notes and the presentation. You can go back and.
It's in the notes, is it?
Yes, we'll give you the notes as well.
Then fine.
Right. You see, high blood pressure and other diseases like thyroid problem, brain attack, stroke, or heart attack, or abdominal problems like accumulation of fat, and the ovary, polycystic ovarian syndrome, PCOS or PCOS, which is common in a lady who is overweight, and then you have the heart problem, people who have heart attack. Now, many of these doctors who have done research in the recent few years, 5 years, have come to the conclusion that all these problems are because of diabetes only. Like Dr. Pradeep Jamnada says, 100% of coronary artery disease, which means heart attack, is due to the person having diabetes. or stroke, Alzheimer's, dementia, Parkinson's, brain problems, because the blood vessels all over our body becomes narrowed, and therefore the whole body suffers. So this is a very, very serious problem because all our lives are affected. Every single person's life is affected. Whether you are diabetic or not diabetic, your life is affected. Because of carbohydrate intake, the number of times that we eat, which I will come to in the next few slides. So these are some of the complications of diabetes. These are some of the signs of diabetes, like hunger, thirst, loss of weight, sweating, brain fog, and you will have a frequent urination. Ladies will have fungal infection, all kind of problems. Everybody knows this. Most of you know, so I will not spend too much time on all this. So what is pancreas and what is insulin? This, what I'm pointing here, can you see my pointer there? That is the pancreas. And in the beta cells of the islets of Langerhans, Langerhans is a German doctor who discovered where the insulin is secreted. Insulin is produced there, and when the food enters, carbohydrate enters our stomach, the pancreas gets a signal and produces insulin. This insulin in turn will reduce the blood sugar. And that is what we based upon our premises of rising blood sugar as diabetes. Now, I'll go to the next slide. What is the real problem in diabetes mellitus type 2? Type 1 we already spoke about. It is since young. Okay. Now, type 2 hyperinsulinemia and insulin resistance is due to excessive insulin. That is where I said all people are affected by this. Every human must understand that today we are eating like kings, emperors, Chakravarti. Those days we were hunters and gatherers. We had a comanum or some leaves. We ran, caught some fowl and we ate. And the food cannot be kept overnight. There was no fire. We ate whatever we can for that particular meal. That's it. Now we have got KFC, McDonald's, Pizza Hut, the whole works. And now the newest, most fashionable thing is home delivery of food. So even a 6-year-old boy can order food and eat at home. So the number of times that we take food has increased tremendously. And that is a problem. That is a very, very big problem. Because we are going into a stage of hyperinsulinemia. That means the amount of insulin circulating in our body is increasing. And insulin is the unrecognized demon in our lives. We are only talking about raised blood sugar. We are not talking about the raised insulin, which is actually causing all the problems, and insulin is causing us to deposit fat in our body. We are not overeating, but insulin is playing tricks to the brain by reducing the production of leptin. Leptin is required to inform the brain, stop eating. That is not happening. So we tend to eat more. And we don't stop eating. We want to eat many times. And the second factor in the brain is dopamine. And dopamine is a hormone that produces much happiness. You take a warm shower, you get dopamine in the brain. You take chocolate, you get dopamine in the brain. When you take sweets, sugary sweets, sweet coffee, sweet cocoa, or whatever, you get dopamine in the brain. And it makes us crave for more. So the advertisers do all kind of advertisements to portray image of Milo, image of ice cream, image of all kind of cereals, so that the dopamine stimulation is reflected in our minds. Then we are not able to check our food, not able to check our drinks. We want the FNN, we want this orange juice, we want that juice, and all kind of things. They play on the brain, on the mind, on the dopamine. It's not that they love us, they want to educate us on good food. I think some of you have not muted. If you don't mind, please mute your speakers. So this is a very, very important problem where dopamine and leptin is being played upon to play on our body. Children also have the same problem. The dopamine stimulates them to be addicted to sugar. In fact, sugar is even more addictive than smoking.
So are you saying that external factors actually contribute to the playing up of the dopamine and leptin?
Yes.
External factors, external, like for example, commercials.
No, the commercial
is it the body itself, the hormone system in the body itself that is reacting in a way where it craves for food?
The craving for food comes because of the dopamine effect. The dopamine effect comes upon what we remember taking a nice sweet drink like Milo or Ovaltine or coffee or something like that. Okay, when you remember that, the dopamine is secreted in the brain and you crave for it.
In other words, it's actually the control of the mind.
Yep. Yes. And leptin plays a part where fructose and insulin blocks the signal of leptin going to the brain to stop eating. So these two factors are the most important factors. So what are the dietary problems is cut sugar. We have to ban sugar.
How about brown sugar?
All sugars, including honey and everything.
Honey also?
Yep. Because once the honey goes into the body does not recognize whether it is from honey or whether it's from the brown sugar or whether it's from the white sugar. It doesn't know.
So we're actually wasting money buying expensive brown sugar.
You should not buy sugar at all.
Thank you.
Why? You see, we want to live from 0 years to 100 years in a healthy manner. Nobody wants to get a stroke at 65, 70, 75, 80. And then we lose our dignity and somebody has to take care of us. It's a shame. Every person who has this problem will think, I'd rather die than be a burden to my family.
But doesn't our body actually need sugar to a certain level? Because when the sugar level is low, we actually become hypo or something.
I would say this write down first, then easier.
Yeah.
Okay, you just carry on first.
Yeah.
The questions will be later on.
Yeah, I think I tend to lose my trend of presentation. Because if I have to answer the question, then my trend of thought gets disturbed.
During the later on,
Now, I've also lost the presentation slide.
So sorry.
No, it's okay. Okay. Okay, dietary disease is to cut the sugar completely because we don't need evils in our life. every single starch, whether it's rice or chapati or puri or whatever luxurious food from the most expensive restaurant in the world, is ultimately broken down into glucose. And that becomes poison in the body. And glucose is utilized by the whole body, but the body knows how to manage the glucose. We don't have to be consciously taking excessive amount of glucose, and I will explain this later. So what is best would be for people, the food will be different. For a young growing baby will be different. For a young boy will be different, young child will be different. For an adolescent, the food will be different. For a young person will be different. For a 35-year-old man, the food is different. For a 50-year-old man is different. And for a 70-year-old plus man like me, it will be different. We have to eat different meals and different kinds of food at different parts of our lives, and depending on the kind of work I do. If I'm like those days, they carry those heavy sacks from the now they use crane. Those days when I was a kid, they used to work in cargo handling in the ports, carry sacks and sacks and sacks. So they need a different kind of food. People who are farmers need different kinds of food. So I'm saying this, mainly what I am speaking about is for people who have overweight problems and people who have diabetes and potential diabetes problems. So you have to have a meal which is no carbohydrate to low carbohydrate. If you are overweight, no carbohydrate, full stop. No choice. That will be the first thing that we have to do. If we are not able to stop it immediately, cut down to half, quarter, and stop it as soon as you can. Otherwise, we are putting ourselves in trouble. Insulin drives weight gain. Insulin, they say, it is found to be lipophilic. It produces fat in our body. The insulin would send signal. Insulin is a growth hormone which produces the fat in our body. In all over our body, there is fat. And that fat, especially under the skin and in the internal organs, is the worst. So that is around the heart, around the stomach, around the liver, around everywhere. Around the intestine, in the omentum, we have fat everywhere. In the ovary, in the uterus. And all this is very, very harmful to the body. Now, too much frequent meals causes too much insulin. Every time you take a drink which is sweet, you are telling your body to secrete insulin. So just imagine the amount of insulin that you take into that is produced by the body. What happens to the blood sugar when the insulin acts on the glucose or on the blood sugar that we have taken? It doesn't get lost. It is metabolized by the insulin. The insulin causes a reaction to metabolize that sugar. And that sugar is driven into every single cell in the body. It doesn't disappear. So this sugar in the tissues will cause all kinds of complications. In addition, now we have another elephant, that is the insulin. The insulin itself is causing more and more problems. Today, many people will say insulin is a bigger problem than the sugar itself. I'll just give you, I'll come to an example a little later. I worked in orthopedics. I did my postgraduate program in orthopedics. And I have also amputated many people's leg, cut it off. Every time I used to feel like, something, I'm cutting off a part of my body. And the whole premise of treatment was wrong, including me, was wrong. Because what we used to do is give intravenous insulin to reduce the blood sugar, not realizing the wound in the leg or the foot is because of the infection in the tissues. We don't have any medicine available to reduce the blood sugar in the tissues. We only have medicines to reduce the blood sugar in the blood. And in this case, it is not of much use because the tissues are rotting with the sugar and it's teeming with bacteria. The bacteria is growing. The wound is getting pussy, getting more and more pus. The tissues are breaking down and we are doing dressing and dressing and dressing. So eventually, most diabetic wounds don't heal. And they end up in amputation. Now, if a person has a lot of alcohol in the body, but he's sober, and can you give him more alcohol? Because to calm him down, you cannot. So this is what we are doing. We are giving insulin because he already has a lot of sugar, but because his blood shows a high level of sugar, we want to reduce it further and push it back into the cells, which doesn't make sense. See, what I'm telling you is completely new, completely against what is taught by maybe most doctors in the country. Many of them may not agree with me, but I have shared my slides and my presentation with my professor who taught me 50 years ago. He has said, well done, I've got that confidence. And I've shared it with a lot of doctors all over the country, asking them for their critique on my paper. Am I sharing the slide? Doesn't look like it. Okay, yeah, the slides are being. Okay, now I have spoken so much about sugar and all these foods. And one thing I want to say about eating also, look at our modern eating pattern. The lowest decile of eating is 3.3 meals per day. The highest decile of eating in different occasions is 10.5 times a day. Eating late, 25% of calories are consumed before noon. 37% of calories are consumed after 6 p.m. 100% of maintenance energy requirement are attained after 6 p.m. Now there is one doctor by the name of Sachin Panda. He works in the Salk Institute and he was awarded the Best Scientist Award for 2010 to 2020. He was the best scientist in America. The Salk Institute is from where the original polio vaccine was produced 50 years ago, 50, 60 years ago. So it's a very prestigious institute, and this man is one of the heads of the department. He did a research on some mice where the mice were fed with 1,000 calories per day. So the one group of mice were fed with the food worth of 1,000 calories. From morning till night, the mice can eat any time. Another group of mice were fed 24 hours, but at structured times, morning, afternoon, evening. That's it. Night, they are not fed. Now, the two groups of mice, there was a very big variation in their weight gain. Those that were eating anytime and every time, they became fat. The same amount of food, but those that ate at regular intervals during the daytime is considered as not fat, normal. So from this you can see there is a circadian rhythm in our body where we work during the day, we don't eat during the night. And that rhythm is with us from the time we were hunters and gatherers. Because those days there was no light and we slept. So our body DNA is so used to this circadian rhythm. And now with electricity, with night shift and whatever shift, we have changed the whole thing with discos and night food and supper and all kinds of activities. We have changed the scenario. And these are the contributing factors to why overweight is becoming more and more prevalent. It's Therefore, 1 calorie of food is not going to be taken out and is exactly the same because it varies according to the daytime and nighttime. So now neurologists are also saying something similar to Surya Namaskara. They say in the morning you get up at 7 o'clock, go and gaze the sun. Gaze the sun. Or at least it depends on what is the lumens. If it is 100,000 or 500,000 lumens, you just expose yourself to the sun, looking at the sun for 30 seconds, 5 seconds, 10 seconds, or 30 seconds, which is in the tropical countries, that's what we see. If it is a cold season, there is no sun at all, like in Norway or Greenland, then they want you to put a 100,000 volt, 100,000 lumens light and stand in front of it for half an hour. Otherwise, your body will get confused. This is what scientists are saying. Because our brain will recognize the circadian rhythm and operates the circadian rhythm in our body properly. It reduces confusion.
Even migraine headaches reduces.
Yeah, there's a lot of research to be done.
I'm doing it for past 20 years, 25 years.
Gazing the sun.
Every day, morning sun.
So all these things which our ancestral people have said, the rishis, we are about 10, 15,000 or 20,000 year old civilization. All these have been tested and tested and tested. That's why we don't have one founder. It's 1,000 and 100,000 people who founded the various aspects of life. I'm diverting. Let me go back to one slide earlier. So what do? Obesity is a hormonal disease, and glucose is driven into the cells. I've already spoken about that. And after every meal, we are going into a diabetic crisis because the sugar is so high that it's a crisis in the body. Some people fall asleep, some people, they lose consciousness, some of them even unconscious. And we develop insulin resistance. So 45 to 55% of our meals have excessive carbohydrate. And we go into carbohydrate toxicity. Why I'm saying these things in a very strong manner is because we are misbehaving while eating. We will get chance to eat for the next 50 or 100 years. We don't have to rush in and eat and eat and eat. We are not here born to eat. We should learn to eat, to live. Otherwise, we will become sick. So fasting, now the newest and the most ancient method of correcting this is fasting. In the ancient days, we still have Ekadashi fast. That is on Ekadashi days, the 11th day after the new moon and the full moon, we fast. I did not know that it was fasted from the previous evening until the next day lunch. We also fast for Amavasya, where you fast from the previous evening until the next day lunchtime when you offer our prasadam for our ancestors. Think of the ancestors and offer, then we have the food. This actually gives you 16 hours of fasting. This is what is recommended by some of the top scientists today. 16 hours of fasting and 8 hours of feeding. So we are back to square one. And secondly, many people are afraid of fasting. The word fasting seems to be like you are depriving yourself of food. Actually, there's so much of food all over. It's spread in the form of fat everywhere. There's so much of fat that we don't need to eat for days and days and days. There is one Dr. Alan Goldhill. He has a clinic called as True North Health Center in San Francisco. He operates it since 1984 or 86. And he advocates a 39-day fast, a 40-day fast. This fast is a water fast. There are two kinds of fast in food, water fast and dry fast. What is done for this Puasa, Hari Raya Puasa, is dry fast. You don't take anything, no water, no this, no that, for the whole day until from sunrise to sunset. In water fast is what we do. We take water and we avoid everything else for 16 hours. We are back to square one, 16 hours. What does this do? What does this fasting do? Why do we need to do fasting? There is another small story to this from Dr. Yoshinori Osumi. Yoshinori Osumi is a Japanese doctor and a scientist, more of a scientist than a doctor, who got a Nobel Prize in 2016. You can Google his name, for autophagy, which means the body would eat itself. Some of the effete. Effete means some of the worn out cells. Just like, we have socks, stockings got holes, or shirts got holes, we stitch it up, or we buy new ones, or we patch or do whatever. So that is what the cells do. The cells in the lysosome of every cell, we have about 3 trillion cells in our body. All these cells undergo repair on an everyday basis. Not 3 trillion every day. Maybe today is 500 million, tomorrow another 500 million, another day another 500 million. So we have 5 liters of blood in our body. And our red blood cells, all the doctors will tell you, they only last in the body for 120 days. After 120 days, it is disrupted and recycled. The heme molecule, the iron, the B complex, the micronutrients are recycled and reutilized for making more fresh blood. Because the blood cell, the red cell, which is 7.2 microns, it loses its ability and efficiency. Therefore, the cells have to be destroyed. So whether you go to the blood bank and donate or not, your blood is gone. So the blood in your body, some of it, which actually you're going to destroy it yourself, might as well go to the blood bank and give a donation. At least somebody will need it for a few days and you can survive, get them to survive. Give them a lease of life while you are accelerating the destruction of your own body cells. It's okay. If you're healthy, why not? So insulin makes us hungry and want more food. Have you realized that when you have dosa or idli or kway teow goreng or something like that in the morning, lunchtime you feel hungry? If you don't eat anything, you don't feel hungry. Somebody asked me this question about 1978. I didn't know the answer. My cousin actually, she asked me this question. She said, Thambi, when I eat idli in the morning, by lunchtime, I'm very, very hungry. If I don't eat, I don't feel hungry. You know why or not? I just have to keep quiet. That is because when we eat rich carbohydrate food in the morning, it is stimulating the pancreas to produce insulin. And this insulin makes you hungry. to eat more food. And rice does not give the stop signal. That's why sometimes we eat mountains of rice. This slide we have gone through, eating all the time. There is no time limit. My mother used to say, after I came back from India studying, missing my mother's cooking, she will tell me in Tamil, "Innada, koreya koreya kottikittu irukra." Only now I realize how wrong it is to eat all the time. These are some, I just brought something to show you about especially fructose. Because most of you, if not all of you, think fruits are gifts from heaven, from the gods. God has given us fruits. Therefore, we should eat as much as we want. But Dr. Robert Lustig, who's a professor of endocrinology in San Francisco, says fruits are poison. Because fruits have fructose and glucose. Glucose, as I mentioned earlier, is utilized by every cell in the body, by all the plants, all the animals, all the worms, every living being utilizes glucose. Fructose was created by God, but he also wrapped it up in such a way that it is not easy to extract that fructose, the sugar in the fruits. So like sugar cane, he makes sure it is like a stick. You can't bite it. Younger days can bite, now cannot bite. And he made sure that there is so much of fiber that the absorption is slow, and we won't eat more than one slice, two slices, or half the fruit. Today we take 4 green apples, 2 oranges, we whip it, blend it, squeeze it, throw out the fiber, we drink it. Do you think the body is crafted for 4 oranges or 4 apples and bananas and whatnot together? No. Because the amount of fructose that goes in is so much, and fructose is almost useless for the body. It has no purpose at all. It's only metabolized in the liver. So what happens in the liver, in the metabolism in the liver? Just like alcohol, it causes fatty liver. Today, you would have heard so many people having fatty liver. Have you heard of fatty liver? I never heard of fatty liver as a student, medical student, until I graduated. I never heard, because there was no fatty liver. Today, everybody seems to know, and I don't know. So this is because of our eating habit. We have to change. Our body cannot change. Hormonally, we cannot change. Our DNA cannot change. It may take another 10, 20,000 years to adapt to all these. But we can change our food. We can change this to live in a more healthy manner. So this is to show, once upon a time we were taking natural consumption of fruits and vegetables 15 grams per day. And then, because of some promotion in the US, it increased to 37 grams per day in 1977, 1978. And today, in 1994, Enhance is their natural studies group. They have all kinds of groups to study. 54.7 grams per day we are taking in the form of fruits and sugar. Adolescents are taking in 72.8, and 25%, this is fructose alone. See, in the United States, what happened was in the 70s, late 70s and 80s, when Nixon was the president, he wanted to make sure that he's re-elected as a president. And you know, he was booted out, right? Watergate. So he was desperate to be re-elected. So he wanted the people to be comfortable and make sure that everything is good, especially the food. So he created a fixed price for sugar. Everybody was taking sugar, so he created a fixed price for sugar. Coincidentally, Dr. Takashi in Japan also came up with high fructose corn syrup. High fructose corn syrup is one of the biggest enemies in our life because it is there in every food that you buy from the shops. Every single food, bread, buns, pastries, donuts, whatever, it is there. Why it is added is because they want to reduce the amount of oil used in this food because of a directive from the American government for reducing, they thought it was reducing obesity. Actually, this is a very, very huge topic. It may take a few days to cover actually. So they put a little bit of sugar to counter the excessive salt they have put in there, make it tastier. And then there is flavorings, pesticides, there is enhancers and emulsifiers and all kind of additives. All these additives are poisons in your body. These poisons go into each cell and reside there. They are wearing a mask. You don't know who they are, whether it's our own cell or some other cell. So the body mounts an immune response and we get autoimmune diseases. Systemic lupus erythematosus with rashes, we get psoriasis, we get Parkinson's disease, and we get rheumatoid arthritis, and we get so many other diseases of Crohn's disease, where it is allergic to the intestines are allergic to the foods, and this causes disruption in our way of life. But nobody thinks that the food needs to be stopped. They want to put more and more medicine to reduce the diarrhea, reduce the itchiness, reduce the rashes, reduce everything, but not the food, when the food is actually causing the main problem. Right? We all have to have, if anybody has any autoimmune disease, I would always recommend that they have a food diary. In your food diary, you will be able to recognize what food is aggravating your problem. Then you can slowly experiment yourself. Which shop did you buy? What did you buy? And slowly eliminate those kind of foods from your body. Okay. So what I'm trying to say is that the amount of fructose is bad. The next slide will also say the same thing. The perfect storm. When Nixon was the president, that's the first thing he did of stabilizing the sugar. The second thing he did was WIC. He put WIC centers all over the US. Women, infant, and child care centers where they were distributing fruit juice to all these infants. And today we have this problem of high fructose because they have taken sugar in the form of fruit juice 20 years ago, 30 years ago, or 40 years ago, and we have the problem till today. The fructose can be so harmful that even a mother who is pregnant will transfer that problem to the baby. And today, all our babies all over the world, in most parts of the world, are about 200 grams heavier than the babies born 20, 30 years ago because of the nutrition that we are taking. So today we have heavier babies. And I must tell you one thing about weight gain. A woman will gain 2 times in her life. It is created by our body. The first time is when she attains puberty, when she becomes a little girl to a young woman. The body is so beautiful and so intelligent and sophisticated that it recognizes that this girl has got a hormonal spike and she may get pregnant. We don't know what's going to happen. So better we produce the hormones in her, preserve her body fat, make her look big, so that in the event she develops a baby, she will be able to support the baby. This is Professor Robert Lustig's findings, where a woman twice puts on weight. The first time is when she reaches a puberty, or it's also called as age of menarche. That's the first time. The second time is when she gets pregnant. The body again recognizes, that's a baby. You know, there may be shortage of food, there may be hunger, there may be famine, situations are unpredictable, let's store food. So the mother will store food. And that is how nature takes care of the baby. The baby is well protected in the uterus. The baby is growing and growing and growing, well protected from all the dangers in the outside world. And that's a passing remark. Fructose is not glucose. Okay, I won't go too much into this because we are short of time. Okay, now many people have talked about obesity, extreme obesity, and how we can reduce weight gain. Many people have done all kind of the biggest loser. All over the world, they have the biggest loser. They have yoga centers, they have exercise centers, but all of them fail. All of them fail, 100%. All kind of pills, all kind of portions, all kind of herbs, everything will fail. Because we are not changing our natural behavior. If we are going to continue to eat, there is no tomorrow, or we're going to eat as much as possible, it's not going to work. So we have to change our basic behavior. We must eat to live. We cannot think, I want to go to Hong Kong and enjoy the seafood, Hong Kong food. No, it doesn't work that way. Your brain may enjoy it, but your body cannot take it. You cannot go to some fancy food restaurant. I see one restaurant, some fantastic food from Kashmir to South India. They're serving all kind of foods. It doesn't work. Cannot be. Once a year you can eat like that. Twice a year you can eat like that. But making it a regular habit of overeating is not going to work. I have lost in the last 1 year 20 kilos. I was 77 kilos. Now I'm 57 kilos. Because I was thinking I'm a doctor. And how come I'm walking around? I'm trying until I did my research on this and I realized it's so easy. All you need to do is tweak your brain. Okay, this is what I wanted to show you about carbohydrate, where the sugar will shoot up and the protein will shoot up halfway, but the fat does not produce so much of a spike in the blood glucose. Now, we have discussed this already, hyperinsulinemia, insulin resistance, where there is so much of sugar in the cells that we are pushing in more and more and more. We are taking tablets, so that the blood sugar comes down. And once your blood sugar comes down, your doctor pats you on your back and says, well done. Everybody says, how are you? I'm very good. My blood sugar is 6, 7. But still, he ends up with a heart attack. He still ends up with a problem in the foot or he ends up with all kinds of blockages all over the body. He still gets a brain attack.
Even you control the food, the stress level will you.
The stress causes inflammation. The sugar also causes inflammation. So when you have combined carbohydrate stress and sugar and the normal stress, I mean the carbohydrate inflammation and normal inflammation is a double whammy. The moment you reduce your carbohydrate, the stress is only half. So definitely the stress will, and you are a meditator. If we are to take meditation, self-introspection, instead of traveling to Hawaii and traveling to all over the world, we should travel within our body, within our mind to see where we are, what are we, understand ourselves, think introspectively. To travel all over the world is very easy, but to travel inside the body is tough. That's what we need to do. And that's where the answers are anyway. So what I'm trying to say is blood sugar control alone is not enough. Controlling the carbohydrate to reduce the amount of sugar in the body is important. Diet control is the remedy and carbohydrate restriction. So the main problem is inflammation. Why do we get heart blocks? Because hyperinsulinemia and especially fructose will cause the production of very low density lipoproteins, which will go underneath the covering in the blood vessels. Our blood vessels, these are the veins. In the arteries, it goes into the under the covering and it starts build up, like you can see here. It builds up and narrows the artery. That causes blockages. And these blockages then reduce the amount of blood flowing to that part of the heart. But the most beautiful thing is our body also produces collateral circulation. That means if one artery is blocked, another branch of artery grows and connects to the distal part, the further portion, and try to re-establish connectivity. But I don't know why many doctors are not talking about collateral circulation. I don't know. I'm very curious why doctors don't talk about collateral circulation. I only heard one doctor talk about collateral circulation in a very professional manner, Dr. Bay. Dr. Bay runs the Japan Heart Center in Bangsa. And many years ago, about 20, 30 years ago, when I took one of my patients there, he explained that many of your heart vessels are all blocked, but your myocardial perfusion is excellent because of the collateral circulation. I have not heard any other doctor talk about that. They always say straight away, you need a block, you need a stent, you need this, you need that, but they don't talk about collateral circulation. I don't know. I'm very open. I know some people may be listening, they may be doctors. It doesn't matter to me. Collateral circulation means, is it? Collateral circulation means, suppose that I have an artery blocked in my heart. The blockage does not happen overnight. It takes 10 years. While that artery is narrowing, another artery branch is growing by the side. Because compensate, exact word is compensate, so that it goes further and connects with the artery and re-establishes the blood flow. I did not think about this. The doctors are not talking about it for many years. Only recently I'm thinking.
So it's a natural thing.
Natural. It happens in every human being. That is why your aerobic exercise is useful. When you exercise, your heart rate goes up, your muscles build up in strength, your blood demand increases, and your collateral circulation increases. The same thing goes with the legs. The faster you walk, the demand for more oxygen is greater, the demand for more blood is greater, therefore your collateral circulation around your knee and in the calf takes place. I don't know why doctors are not addressing, giving importance to this. I think we have to be open about all these things. So reduced production of nitric oxide. Nitric oxide is produced in the blood vessel so that the blood vessel can dilate and become bigger. When the demand is required, it becomes bigger. Otherwise, in systole, when the blood is shooting out of the heart, the blood vessel can dilate and accommodate that force. And when the blood returns, it can come back to smaller size so that the return is better. We lose that function with insulin and fructose, manufactured uric acid. And this causes high blood pressure. So when I had a high blood pressure in 1985 or 86, I went to see one of my doctors in General Hospital. I was in General Hospital KL at the time. He said essential hypertension. Even my lecturers had told me, we don't know why we are calling it essential hypertension. Yeah, it's not possible for hypertension to be essential. It's not essential. It's useless actually to have high blood pressure. So now I realize that that high blood pressure that I had for a few years was not because I was working tirelessly in the wards. Orthopedics and trauma is crazy. You work 24 hours every day. Now that I have stopped my food, eating carbohydrate and reduced my insulin, my blood pressure has disappeared. So for all of you, that is why I said for everybody, every human being, we must follow a certain proper diet to live long and disease-free. Disease is very, very crippling, causes obesity or overweight, and very, very expensive. Many people will think I have a boss, Sri Sukumar has taken insurance for me, the insurer would pay. But who is going to go through the procedure, the treatment, the surgery? Who is going to go through the heart surgery? It's me. He's not going to go through the surgery. I'm going to go through the surgery. So in my company, this is what I do. I tell the patients, take care. So I'm not paying your bills. Your company is paying your bills. But do you want to go through the surgery? But many people think my company is paying, my insurer is paying. What the heck are you stopping me? That's my business. My business is to ensure people are not operated unwantonly. I'm saying it in public. I'm not afraid. Because for me, you have only one body, one life, one finger, one eye, once. Your left eye is only once available for you. Your little finger is only once available for you. You have to take care of it. I can't take care of your hands or your feet or your diabetic foot or whatever foot. I can't take care of it. You have to take care of your weight. If you have to starve, please starve. If you can't starve instantly, do it once a week, 1.5 times a week, twice a week, gradually move towards. You've got to tweak your mind. You've got to tell yourself, I want to live happily, healthily. I don't want my brothers, my sisters, my husband, or my wife, or so and so and so and so to take care of me. I was with my friend Prakash Panikar in India. He was my classmate. No. Sorry, I mentioned his name. Anyway, he's no more. He passed away. Prakash developed Parkinson's disease. He was somewhere forgotten in Sandakan. Many of us did not know where he was. So I went looking for him in Sandakan and I found him. He was thin, shriveled, torn bunion, skin and bones in a bag, in a bunion that is like a bag. He looked like a ghost. Cannot move. His hands were, one hand was like this, one hand was like this. Because the physiotherapy was poorly done. His legs were extended. The foot was extended. He couldn't flex. Somebody has to take his penis and put it into the urine pot for him to pass urine. And somebody has to put a glove and dig out the feces for him every day. So I went with him to Narayana Ashram in Kundrakudi, Pullayarpatti actually. Just near, I told you, just near the Pullayarpatti Ganapati temple is a cave temple, a huge Ganapati in a cave. Just opposite, there is one Narayana Ashram there. So we took him there, and that Guruji, I think Govinda is his name, Govinda Guruji, said you people stay in Kundrakudi, which is a few kilometers away, 2-3 kilometers away, and we will do some treatment for him. I didn't believe in the treatment, but he wanted it that way, because that was his last wish. When I went to visit him in Sandakan, he said, if you come with me, I will go to see the Narayana Ashram and I will get treatment there. So we flew him from Sandakan to Subang at that time. Subang, the airport was in Subang. Subang to Chennai, Chennai to Madurai. Then from Madurai, we took a bus, chartered a bus for him and carried him to the ashram. He died there after 6 months. I stayed with him for 3 weeks and told him, look, I have to go back. My wife is screaming. The children are screaming at me. I have to go back. Then, when I left my ticket with him and said, this is proof that I will come back for you, whenever you call me. And he died. So I went back, cremated him on the banks of Vaigai River in Madurai, brought his ashes back. So is this what we want? I'm telling you a very frightening story, not to glorify myself. Please understand. I know I am a dust, nothing. We are all nothing. We are just tools, put here by our birth. We are fortunate births to help 1 or 2 people here and there. That's all, nothing more than that. If anybody thinks he's some great guy, I would like to salute to him. So do we want this? So I'm saying it in a very emotional and passionate way because people listening must understand that the only way you can live happily, one way only, if you are healthy. Health is the foundation of all kind of happiness. Every single happiness depends on your health.
This is equal. This and is.
Okay. So other things, lipophilic, the insulin will increase the fat storage, clogged up artery, get brain attack, heart attack. Any questions? Endocrine disease and infertility. These will go on and on and on actually.
Okay, just give me half an hour. Because my association may having another question.
So I wish to stop here actually because and prefer to answer some questions. You can eat all this food and vegetable unlimited you can eat to fill your belly. But again, you tell yourself once your stomach shrinks, you don't want to eat, you can't eat so much. It is the desire, to eat more. I want to feel full.
What are these fruits, Dr. Avocado? Blueberry.
Maybe these are, I'm not sure what they are. I know the olives are here. These are the olives. Yeah. This is what do you call that? Malaysia they call it the Sabha vegetable, but actually it has got a nice name. So you can take eggs, fish, meat, chicken, whatever you want. I'm vegetarian, staunch and vegetarian activist, but you have a right to make choice in your life.
What do you eat? I just out of curiosity.
Well, I eat cabbage. I eat cabbage.
Sorry?
This is asparagus. This vegetable is called asparagus. I eat vegetable. Any vegetable I will eat. Preferably, I like cauliflower, the cabbage, green leafy vegetable, and now we make flaxseed bread. Flaxseed mixed with almond powder, psyllium husk. Actually, I just made one loaf of bread yesterday. So that is no carbohydrate. You just put on YouTube, there are hundreds and hundreds of videos on YouTube.
You don't take rice at all.
Amavasa days, when we pay respects to my late mother, father, I take a little bit of rice.
This question, okay, about this glycemic index for carbo. Apparently, when I was doing research, we call it pearl rice is the lowest. It's actually plurality compared to.
Yeah, understand. All kind of basmati rice, this rice, that rice, brown rice, red rice, black rice, all kind of rice. Why do you want to eat rice? You are not well. Why do you want to eat that? If you are perfectly healthy, okay. Because we are made up of different kind of constituents. Some of us have brown fat, some of us have beige fat, some of us have white fat. The beige fat are those fellows who are thin. They eat huge amounts of food, they remain thin. Because the mitochondria is burning off the energy in their body. Some of us think of food, we put on weight.
That's the case for the intermittent fasting for 16 hours. All right, once you complete the 16 hours, that means you can go back into your normal diet, right? That means, are you going to be like?
As I said, it depends.
Calories count.
No. It depends on what age you are and what is your nature. If you are a diabetic, pre-diabetic, you have overweight problems, the diet would be different.
Okay.
A person of my age, I'm scared of food now. I don't want to put on the weight all over again, go through the same problem.
So basically, you have to
tailor make it according to your body constitution. Yeah. Don't worry, you will have many birds to enjoy all those foods in your next lives.
Whatever happens to the foodie, you can't avoid food.
That's alternative sugar.
Alternative sugars are like aspartame. Then there's one sucralose. Then there's xylitol. Equal is aspartame. Aspartame is actually one of the essential amino acids called phenylalanine, which is modified and made into aspartame. Now this, in the interim period, when you are migrating, you can take. That's my view, not my scientist friend's view, my view. You can take to soften the hardship that you are facing. It all depends on you, how you want life. You want to take the real sugar, go ahead, but be aware of the consequences that you're going to face.
Yeah, but they say that it's always about moderation. So if we think in moderation, is it okay?
Okay. The word moderation, I attended a talk in Singapore. The talk was presented by one doctor. His name is very nice name. He's a breast and endocrine surgeon, or I think he was a cardiothoracic surgeon. I'm not sure. From the Cleveland Clinic in Ohio. His name is Dr. Caldwell Esselstyn. He is also an Olympic gold medalist in the 1960 Tokyo Olympics. So, he's a grand old man, a tall 6-footer. He's operated on thousands and thousands of people. He says the word moderation is the word that he will not accept. Because for one person, 1 teaspoon is moderate amount. Another person, 1 tablespoon is moderate amount. For a third person, 1 cupful or half cupful is moderate amount. For another person, 1 cup food is moderate. So which is moderate? He says abstain from SOS, salt, oil, and sugar.
The alternative sugar, when you said just now aspartame and all that, what is it? Is it like some form of chemical?
Yeah, it is actually phenylalanine, which is one of the essential amino acids modified. See, phenylalanine has got end product called phenylketonuria. Phenylalanine is excreted as phenylketonuria. Some name, I forget the name. And the people who, the phenylketonuria, where the phenylketones are excreted in the urine, is called phenylketonuria. In some people, they have an error in metabolism where this accumulates and causes paralysis in the brain.
So it is equally harmful,
Yep.
but in a different way.
Yep. Is your body, your mind, the what was I saying? I forget the word just now.
Dopamine.
Dopamine. The dopamine is working in your mind now and telling you how you can remain happy.
because I love sweet stuff, I have sweet tooth. So I'm very unhappy
Take,
now.
take.
Dopamine is telling
So what
me
you
to
do?
think of ways to.
You take Vapella every day. Take Vapella every day.
Just now you said fruits are bad for us, but does it? I think what you meant is take the juice is not good. If I eat with the fruit, is okay.
If you don't eat anything else, like the fruitarians, it's okay. You can't be eating fruits, rice, kway teow, then chicken, mutton, then you want to eat cashew nuts, almond nuts, these nuts, that. Any questions? Any questions, please?
Doctor,
Yes, I have a question,
yes, I
doctor.
have some questions.
Yes,
I have
please.
a question. Can I ask you a question? I'm Parimala and I'm a member of the GDS, and I want to know, you were mentioning that insulin will cause, you can put on weight with insulin. I'm on insulin. Can I stop insulin like as it is like that?
Oma, please call me privately, ma. Please call me privately. My number you have. And then because you know why? I'm not trying to be secretive or something like that. I need to know how long you have been a diabetic. I need to know whether your insulin studies have been done. I need to know what kind of insulin you are on, what are the other medication you are on. The first thing I would advocate to you is 100% stop your carbohydrate. And then are you a doctor?
No.
You have to titrate your needs of medication according to your meals. The first step is to stop all forms of sugar. The second step is to stop all carbohydrates. Please send me a WhatsApp message. I'll reply you.
Thank you.
Thank you.
Doctor,
Another gentleman.
I have a doubt.
Yes, sir. Please tell me. Yes.
Are you able to hear me?
Yes, very well.
Yeah. What do you think about the small grains like kambu, varahu, which has been advised many of these Ayurvedic doctors for diabetes?
Siridhaniyam, that is Siridhaniyam in Tamil, right?
Yeah, they call small grains Siruthaniyam.
Kelvaragu, other forms of millet,
Yeah, kambu and some other grains.
foxtail. It's also called as foxtail millet.
Yeah, foxtail.
They are all excellent, very, very good. But you cannot go on eating rice and that as well.
Is it included in the rice varieties because it's whole
Yes,
grain? Does
yes,
it have
yes.
carbohydrate the same amount what a white rice is having?
The absorption may be slower, but you have to look at the glycemic index. But I'll have to look it up and come back to you.
Okay, is it the glycemic index that counts or the glycemic load? Because few of the doctors are saying glycemic load of the material is very essential.
Both are important. If your glycemic index is low and you
Okay.
take 1 ton, then it's already high.
Yeah.
If the glycemic index is very high and you take 1 teaspoon, then it's low. The glycemic load is low. So you have to. I need to know your age. Yeah, I need to know your age.
I'm over 75. And what are the type of cardiac exercise you are suggesting? I go for about half an hour walking.
Excellent.
Maybe, but still I have diabetes. I'm taking
No,
metformin.
metformin is great.
500 morning 500, night 500 I am taking. It fluctuates normally. My HbA1c comes up to 7.9 sometimes.
Please send me a WhatsApp message. We will have a conversation on this.
And one more thing, what do you think about the supplements like Gymnema, Silverstay? Nowadays they are talking much about it, and also the berberine, which are all the olden herbs which has been used by the Ayurvedic people for treating the diabetes. Do you have any idea, doctor, about it?
What idea I have is blood sugar is increased by taking in over the limit of starchy foods.
Oh, okay.
If we can reduce the amount of starchy foods or stop the starchy foods depending on what is the level you are, then you don't need anything else. Because if the roof is leaking, you need to fix the leak.
Understand.
I can't tell you, you put a big bucket, it will last for a longer time. You better put a big drum, then 1 year you don't have to change the water. There's no point.
Oh, right. One more doubt, doctor. Do you think just a half an hour walking will be enough? Does it give the cardiac exercise? Is it enough, or can do something more than that?
No, it's enough, more than enough. But what is important for your heart to remain healthy is for you to do your intermittent fasting. When you do intermittent fasting, some parts of your body, especially your blood vessels, will do autophagy. They go into autophagy mode and they will repair itself. You have to give your body a chance to repair itself. Everything in life needs to be repaired, including our body.
Often we have to go for fasting, doctor. That is the big problem for me.
Yes, it will be a problem. You start 1 day a week, increase it to 1.5 days a week, then you increase it to 2 days a week. It all depends on your level of activity, what you want. Anyway, by eating every day, every meal sumptuous, luxuriously, how does it make your life better?
But most of the days, doctor, I take morning 1 apple as my breakfast. That's it. Then afternoon I take some serotonin, small
That's
grains.
okay. That's very good. Excellent. You will keep me away. An apple keeps the doctor away. That's good.
Thank you very much for informative.
Welcome.
Thank you.
What kind of exercise is suitable?
Any exercise.
Any exercise, as long as
Because exercise.
Housework, is that
Excellent.
Yeah, I think that keeps my mom going.
Excellent, because the housework involves all the muscle groups in the body. Whereas when you go to the gym, you're only doing this and this and this. When you carry something, you are using your shoulder muscles, your arm muscles, hand muscles, your finger muscles. Every muscle is activated. So your compound effect of the muscular utilization is good. And muscle exercise is extremely useful because it prepares your muscles to be insulin sensitive. Now, 2 slices of bread, if you take extra per day, you are taking in 120 calories extra. So just imagine in 1 month, you will easily put on 1 pound of fat extra. If you take 2 slices of bread, immaterial of what exercise you do extra.
Okay, that's my other question, doctor. Okay, I'm 52 right now, and touch wood, I have managed to come to this stage without any major complications. That means no diabetes, hypertension, cholesterol. Yes, I had. Now it's under control, I believe. So can I continue with my lifestyle because probably it suits me? That means
Reduce, you can continue, but just reduce your carbohydrate by 50 to 75%. Because the cholesterol excess itself means that some storm is brewing. Slowly. We don't want you at 65, 70 to say, oh, I'm happy still now. Now I've got a bit of high blood pressure or something like that. Might as well till 100 you live well.
And then, okay, I have gastric. How do I fast? Because, and also I can't skip my meals. If I skip even a meal, my hands will start shivering.
Can we speak to these people and I'll continue with you? Okay. Any other questions, please?
It's good for them, but it's good for them, right?
Yeah. If there's nobody, I will answer your question. See, gastric is a small problem which is blown up out of proportion. My opinion. I've been a doctor for almost 50 years now. The gastric juice in the stomach is very important because the mouth is our connectivity for the body with the external world. You eat biscuit, somebody serve you rice, curry, tair, all kind of food they will serve you. And how clean, we don't know. But the gastric juice with a lot of hydrochloric acid there, it acts as an acid barrier. Why do we get gastritis? Is it because of irregular meals and all that? I don't agree with that. Although 99% of doctors may agree with that, I don't agree with that. Because our body has got a certain meaning. It's not there as a joke. You are not born with a deficiency of antacids or deficiency of nexium. Or you're not born with all those things. These are all artificially created. So you keep a food diary and find out what kind of food that you took caused you the gastritis. Don't assume it is blanketly because I'm irregular eating.
The problem is I take my meals regularly.
And still you get gastritis.
And still I got very severe gastritis.
Yes, because of some of the food that you are taking may have triggered, especially wheat-based food. Because we are not used to eating too much of wheat. And today also the wheat is modified, genetically modified, GMO wheat. So the GMO wheat has got more lectin, this lectin, which can stimulate adverse reactions in the stomach and you start belching and all that. Sometimes it can have even very serious problems.
So fasting will not aggravate gastric?
No. Although some people will say, yes, I must cope, I must do this, I must do that. I don't believe it. My personal view, maybe I'm grossly wrong. That's what I believe.
What do you recommend as, you can't take rice, carbohydrate or whatever, what do you substitute, what do you recommend, what do you suggest?
Okay.
Like
upama is wheat. The first thing you need to do is find yourself an appropriate weight. Come to the right BMI. And then you keep a food diary and see what food is suitable for you. Because all of us are different. We eat different amounts, different food. I'm vegetarian, I may be skewed towards talking vegetarian. You may take something else. So I can't tell you, no, you must become vegetarian. No. What you want, you eat. But be wary that meat and many of the other food also has got its own problems. But if you're looking at carbohydrate, the siridhaniam is good. Kelvaraga is very good. Then quinoa is good. And kambu. There are many other available. Now the internet is full of all that. Flaxseed bread.
You can do like a bowl of salad with the...
Anything as you feel comfortable with.
So it's completely like, okay, like for coffee, milk is okay, right? Milk is protein.
For some people,
It's completely cannot, right?
can take, as she said, moderate amount. I can't take because I've become allergic to milk now. So it all depends on the individual. And moreover, we are moving more towards veganism.
Okay.
That includes milk, avoiding milk as well. So my friends are all vegans. We are in the vegan community. Yeah. Take charge of your body. Remain well,
I'm just
healthy.
thinking what to eat because it's like, because I'm in the banking, so sometimes we go out and all that. I have my meetings and all that, you know. So and then
Take food with you. Take food with you always. At least a sandwich or something like that. You prepare it yourself because shop, they want profit maximization. Maximization, you know. And they buy the cheapest quality. And what additives go into that, we don't know. They say brown bread, but is the brown bread really brown or colored brown? We don't know. Brown sugar is colored brown. Most of it is colored brown anyway. They just add some colored brown color and coloring.
Because I was reading an article, they said you have to consume about 1,500 calories a day.
Depending on your work, maybe about 1,500 to 1,800. Any questions, please?
I would like to share something.
Please do.
A very good morning to every one of us today.
Good morning.
My wife and I were found to be diabetic many, many years ago. And apparently, my wife was very much asked to go on insulin without fail. And it was a big challenge at the moment. One fine day, we came across this rice called samai, which is a part of Sirudaniam as well. And we challenged the doctor that visit, we will definitely bring down the sugar and we will remove insulin. So it took us about 2 months. We followed this very strictly. And apparently, after seeing the doctor was very much shocked. And then I related, after finding out more into the Sirudaniam, and then I related everything to the doctor, and the doctor started recommending this to many of her patients in terminal age. Apparently, this proved to be really, really good. Now, each per 100 gram of this samai rice is only equivalent to 41 calories. You just cook it as rice and you consume it. Even in the night, you can take it. Even you can take it in the afternoon as well. And the Sirudaniam is one excellent product. At this moment, I just came back from India and I went to a particular hospital where they only treat for diabetic people. Only for diabetic people. Huh? Now, they recommend all the Sirudaniam.
Which hospital, please? Which hospital?
This was the MB Diabetes Center near Royapeta in Chennai.
ND, is it? ND.
MB, Malaysia, Victoria.
Oh, I see. Mohan
Diabetic Center.
Mohan.
Am I correct?
Yeah.
Mohan Diabetic Center.
I did not see the doctor.
Mohan
I saw
Vishwanathan.
some.
His father was a professor of medicine when I was studying, Viswanathan.
Yeah, you are right, sir.
Yeah, correct.
MB Diabetic Center in
Viswanathan,
Ananagar.
No, I've been there also.
No.
I'm saying I've been there too.
All right.
Anyway, good, very good. I'm very happy for you. Extremely happy for that you are sharing this view. As I said, it all depends on the individual, whether the person has been a diabetic for 5 years, 10 years, 20 years, 30 years, whether they are associated with, different kind of complications. The treatment would change according to the severity of disease and severity of complications. But nevertheless, what you are suggesting is extremely good. And also people like Dr. Jason Fung and Dr. Jamna Das and Dr. Yoshinori Osumi the intermittent fasting for autophagy is so very vital, because the body is able to repair itself. I agree with you completely.
Well, my other experience was in Klang Hospital, where we shared a lot of things with, I would like to mention the doctor's name, Dr. Santa,
Okay, yeah, in Klang Hospital, is it?
in Klang Hospital. And
Okay.
she has started recommending a lot of the Sirdanium to many people, and they all found to be really good. Like what you said earlier, it's better to go on a package of vegetarian diet on a moderate basis of protein diet. It proves really very well for diabetic people. Lots
Agreed,
of weight. Thank you.
agreed.
Thank you.
Completely agreed with. I completely agree with her. I attended one of her functions also. She organized a diabetic dinner or something like that. Is there anybody else? Anything else you want to say?
Yeah, I'd like to ask you. My name is Dr. Saras. I want to ask you how important are oils, the oils we cook with in the case of diabetics, because I know we talk about olive oil and stuff like that. So can you just say something about that, doctor?
I will send you one video where my classmate in school, Dr. Veda Kumar, who is actually he's a oil specialist. He used to manufacture specialty fats, but generally in the diabetic circles that I do the reading and researching, Dr. Caldwell Esselstyn does not support oil. As I said, SOS. Avoid sugar, oil, and salt. And of course, he also tells to avoid milk. He believes, that is these four ingredients are the main culprits. But now going through the mill with other doctors as well, I think coconut oil, olive oil are good, and avocado oil. Many of the body, the body is the only precious thing that we all have. We don't have our diamonds or the Ferrari or a bungalow or whatever is not more important than our body. Why not we spend a little bit more and get the best oil?
Yeah.
That's what I always tell my patients or my friends. Why do you need to go and buy the cheapest cooking oil? Because the cooking oil, it can also degrade the quality of food that we cook. Some of them use recycled oil. We don't know what has been cooked with that oil, how many times it has been filtered. My friend recommends coconut oil, and he used to work in the palm oil manufacturing, so he recommends palm oil as well. Otherwise, he thinks that I can send you a video of him talking.
Thank you.
About olive oil and also on
Doctor,
yes, sir.
Olive oil, when it is heated, I think it loses its property. So olive oil probably can be used as on the salad or something like that, but cannot be used for cooking. That's what the expert says. Is it correct? Do you have an idea of?
Well, I used to believe the same, like what you believe also. But
Okay,
many of the others are advocating the use of olive oil. So I'm also as confused as you are.
yes, sir.
So if you can send me the link about that, what you said just now, that I would love to relook at that and do a little bit more research on this. But my friend, Dr. Veda Kumar, who is actually a biochemist and a scientist, he doesn't believe so. He says all oils behave the same way. He does not believe that olive oil, when heated, will lose its or will become hydrogenated. He doesn't believe it.
Okay, thank you.
Right, thank you.
Doctor, can I also just ask about you mentioning about inflammation?
Yes.
And I was told that if you have more omega-3 oils, it would help to reduce the inflammation, etc. So what's your take on omega-3?
Very good question. I used to be a strong believer of omega-3 as well, because omega-3 is supposed to reduce the inflammation. But the far worse inflammatory agent is the insulin. Insulin is the master criminal in our lives. So why not we go after the master criminal and add omega-3 as one of our support weapons in the form of flaxseed or seaweeds, or in these other seeds, like chia seeds. They all have a lot of omega-3. You are right. Omega-3 is a very important iconoside, as my friend says, Vedakumar says. It definitely decreases inflammation.
Thank
Right.
you.
The other thing, doctor, you said something about eating different at different ages. Can you just tell us something about that?
Yeah, if you have a young boy, a young girl or a young boy who's growing up, they need different kind of food. But generally, Dr. Robert Lustig says, don't give children sugar at a young age. Because if you start them early with sugar at a young age, they will have greater difficulties in giving up sugar at a later stage. So if you're looking at young children, they need to eat fruits, they need to eat different kind of food. Children don't walk, they run. You and I walk, but children run. So they spend a lot of energy running all over the place. And they play a lot of games, they jump, they squat, they do all kind of, they tumble down and they, somersault and do every single activity that you can think of. But as we grow older, adolescent and youth, they will take games, play games. They're also very active in sports. We must encourage all these because the developed muscles is very, very important in the long run. The muscles are the one that will keep us going, not the bones. I think you know that we don't stand on our bones, right?
Yeah.
Because a paralyzed man has bones, but he cannot stand. So the muscles are so important. So similarly, a young lady, 25, 30, she also needs a lot of energy and to walk around or go by bus and so many activities. But a person like me, about 70, I used to walk about 1.5 hours a day in the morning. Of course, at that time, I did not feel the stress, but now, after reading that, it can, I'm concerned about the accidents in the walking, because when you walk in the botanical gardens, there's so much of, when it rains, it's slippery. I fell down 4 times last year. That sort of frightened me a bit. So the food part of it, as we grow older, we have to realize that food is to be eaten to survive and live happily. Food should not be, should be a social gathering event, but food should not be like something that is luxurious, sumptuous, and satisfy our mind. At an older age, we got to find other methods of things, other things to satisfy our minds rather than food. Because to be satisfied by eating a lot of fanciful food and funny foods, you really don't need much thinking. Sorry if I'm a bit harsh on that.
Thank you. Thank you.
Thank you. If there are no questions, further questions, can we close this session? You are free to send me a WhatsApp message, then I'll be able to talk to you or whatever. And we can always have a follow-up session. No, I don't have.